Okay. Sai Ram, dear brothers and sisters, my humble pranams to our beloved Lord, dear Bhagwan Sri Satya Sai Baba. My name is Dr. Nishi Dhawan, and along with my medical team members, Dr. Avi Ramaswarup and Sister Patricia Stevens, I would like to welcome you to our first medical health webinar. I pray that Swami has kept you under his grace during these challenging and unprecedented times of COVID-19. Along with normal day-to-day stressors, COVID-19 has brought additional challenges, anxieties, and isolation to many people across Canada. So with this in mind, the medical team has decided to start initiatives with mental health, and we wish to introduce to you Dr. Atul Nanda, who will be speaking on COVID-19 stressors and anxiety, how to deal with stressors and anxiety. Dr. Nanda brings a wealth of experience with him. He has practiced medicine for over 35 years and is a geriatric psychiatrist practicing in Greater Vancouver for more than 20 years. He has served in many capacities, including mental health clinics, private practice, and in the hospital, and currently serves as he's in charge of the residential geriatric psychiatry at Mount Hospitals in Greater Vancouver and Fraser Health Authority. Dr. Nanda is an ardent and long-time devotee of Swami. He brings with him a wealth of life experience and medical experience to help us understand how to deal with stressors and anxiety in this difficult time. So today we are going to have a presentation with Dr. Nanda. He will speak for about 35 to 40 minutes. And after that, we will have a long time, or we have ample time for question and answers. So please use the chat feature on your Zoom to enter any questions you have during the presentation. Dr. Avi Ramaswarup will gather the questions, and at the end, we will have a question-answer session that Dr. Nanda will be able to field and answer all your questions. Please understand that you are all muted during the presentation, and at the time when we have questions, if there's any reason to unmute someone at that time, we will do so. Without further ado, welcome Dr. Atul Nanda.
Today we are going to be dealing with a very, very important, relevant topic of COVID-19, and the pandemic is on, and mental health issues are coming up so very often with the first line workers as well as with in general population. Next slide, please. So the topic becomes very relevant, and I'll start, of course, with my salutations to Swami, my humble pranams at the lotus feet of Swami. I'm immensely grateful to him for using me on this occasion. I would also like to thank Nishi for her kind introduction and also your team for setting up this presentation. Next slide, please. Let us start with first what Swami has to say on calamities. He has said that suffering and misery are inescapable acts of cosmic drama. God does not decree these calamities, but man invites them by way of retribution for his own evil deeds. This is a corrective punishment which induces mankind to give up the wrong path and return to the right path, so that he may experience the godlike conditions of Sat Chit Ananda, that is, existence of wisdom and bliss. He has also said, you must welcome tests because it gives you confidence and it ensures promotion. Next slide, please. Today, the world is in the midst of pandemic crisis, and every one of us has been impacted in the same manner or the other. There are several layers of understanding any situation. In this case, we can try to understand scientifically. This also can be understood philosophically, ecologically, economically, astrologically, and also spiritually. However, I'll stick to the medical model and talk about what is the coronavirus. I'll also talk about the history of pandemic. I'll try and discuss the mind-body connection related to stress and anxiety, and also discuss and differentiate what is a normal anxiety and when does it become abnormal. Talk about some of the symptoms that we can see and who are the people at risk of stress. We will then come to management across the lifespan, talking about the children, the parents, the couples, and the seniors. Also, I will provide where to obtain reliable sources of information about COVID-19. And finally, I'll try and touch on the future of COVID-19. So let me start with what is a coronavirus. Around the world, there are more than 4.7 million people. This was last week's statistics. And I understand last Wednesday had the highest peak of 24-hour confirmed infected cases of 106,000. A third of this is in US. Coronavirus uses its spike protein to enter the human cell. Our body already has multiple germs. In fact, we carry more germs than the human cells. But now and then a new or a novel one finds a home in our bodies. They take root and starts to replicate. These viruses don't come announced. They are the uninvited guests. They are very tiny, just 20 to 400 nanometers in diameter. For example, 1 billion of them can fit on the head of a pin. They come in different colors and forms, rods and circles. They look like Hydra of a Greek legend, like a complete crown of spikes, which is where the coronavirus got its name. It is hard to believe something so tiny could so profoundly change the world as this virus has done. So the question is, why is it becoming difficult to get rid of this? The science has improved so many folds. The truth is that it is not even alive. It is just a string of RNA in a fatty envelope. They are like zombies of the micro world. Without us, which means the host, they are nothing. They lack the ability to grow, thrive, or reproduce. It cannot even be cultured in a petri dish for scientific research. It can only grow in living cells like our own body provides. Once in, they use its cells to replicate and through the blood and lymphatic system spread to different regions in our body. So we have to build on extraordinary defense mechanism. Of course, the best would be to have a vaccine, for which there still is some time, a vaccine that would immune ourselves from this virus. Until then, we have to build on our body and mind, more healthy and more robust. Next slide, please. Next slide, please. Swami has said, life is a mosaic of pleasure and pain. Grief is an interval between the two moments of joy. Next slide, please. Let's go into the history of the pandemic. You will observe that while going through the history, that human reaction and behaviors have not changed. It is also reassuring that our fears and thoughts are not unusual. A pandemic is described as an outbreak of disease that has spread across a large region, for instance, multiple continents or worldwide, affecting a substantial number of people over a short period of time. Pandemic has been more devastating than any other type of disaster. Spanish influenza, which came in 1918, lasted up to 1919, about 1 year. It killed somewhere between 50 to 100 million people, which in fact is higher than the number of people dying in World War I, which was in the World War I, which was about 40 million. Prevention, early detection, and treatment intervention seem to lower the people infected. In the last 2 decades, There have been outbreaks of SARS, H1N1, and Ebola. The expanding world population leads to urbanization, which increases the population density, which favors the disease transmission, and there is a large-scale immigration of animals and people. We are in fact the ideal vectors for infectious agents. Thanks to the planes and ships, we can spread the disease across continent easily and fast. Lastly, climate change affects ecologies that influences the likelihood of transmitting of infectious diseases. Next slide, please. This slide highlights that nothing is new. This world has experienced this before. SARS was the first global epidemic of 21st century. It started in China. It spread to 29 countries in early 2000, led to 8,100 cases. 40% of the population experienced increased stress in family and work setting. 16% showed signs of traumatic stress. High percentage of the population felt, as they put it, helpless, apprehensive, and horrified. Majority, though, majority thought that they, in fact, would be affected, and only a quarter believed that they will survive. Actual survival rate was 80% and higher. People during this time became diligent in adapting person-to-person transmission precautions. Interestingly, those who were anxious were more precautious and were less affected. As one epidemiologist, Michael Osterholm, said, "It's important to be scared. There is a healthy level of anxiety for us to have during a pandemic, a level of anxiety that will allow us to function in appropriate ways." Then came H1N1 in 2009. This epidemic demonstrated that feelings of stress and social isolation worsened mental health of individuals and had adverse social and economic consequences. Interestingly, it also showed that the more reliable individuals felt of the information they received, the better they managed. It also showed the more they felt they could trust the government information, the better was the outcome. Then came the Ebola in 2014 in West Africa. It lasted for about 2 years. There was very high stress and anxiety because of the very high mortality rate. USA was caught in a severe fear, well in excess of any actual risk, mainly because of the high frequency and intensity of media coverage. The fact is, there were only 4 cases of Ebola in US. Next slide, please. Baba has said on Mind and Body, mankind is infinite, marvelous, and full of meaning and significance. Man is not the body alone. In fact, he is the conglomeration of body, mind, and self. Body is the vehicle for action, the mind is the means for realization, and the self is the witness of both body and mind. He's also commented on the perfection of health. The secret of perfect health lies in keeping the mind always cheerful, never worried, never hurried, never borne down by any fear, thought, or anxiety. Next slide, please. HPA stands for hypothyroid, pituitary, and adrenal. Hypothalamus and pituitary are in the brain, and adrenal lies just above our kidneys. We have seen in the history of pandemic that sometimes anxiety can be helpful in our preparedness, as in SARS, and also how severe anxiety, as in H1N1, can leave us debilitated. Let's move on to a mind-body connection. The question is, how is the anxiety created? And what does it do to you? When our mind or system feels a stress or a threat, there is a sympathetic response. That is, certain chemicals are released in the brain, epinephrine, norepinephrine, which has a chain reaction in the brain and activates certain areas of the brain called hypothalamus. And this in turn activates the pituitary. All these chain reactions accumulates to release of cortisol. Most of you would have heard that cortisol is also called a stress hormone. This is released from the adrenal glands. Cortisol has multiple effects. To name a few, it causes a sense of uptightness, nervousness. Your heart rate goes up. Your blood pressure fires up. The sugars are increases in the blood. We become more alert, which inhibits the sleep. We start to sweat. There's an uneasy feeling in the stomach. The functioning can or cannot be affected. Depends on the level of the release of cortisol and the epinephrine and norepinephrine. However, chronic release of cortisol, which leads to poor immunity, heart conditions, cognitive changes, depression, it affects each and every cell of the body. It affects the telomere. And we will talk a bit more of telomere shortly. It should be realized that proper functioning of the HPA axis is crucial with our functioning and is helping us to deal with the stress. But repeated stress, ruminating thoughts, repeated worries is very harmful to us, and it does affect our functioning. Next slide, please. So how are these symptoms present themselves? We are constantly worrying. We are constantly feeling a sense of insecurity and fear about our own health, health of the loved ones. We start to see changes in our sleep, too much or too less. Eating patterns change, too much or too less. We can't concentrate. We can't remain focused. The health conditions become worse. The mental conditions become worse. There is increased use of alcohol, tobacco, other drugs. We find ourselves in a state of lassitude, easily fatigued with poor energy. There's a constant state of preoccupation of mind, of worrying and dwelling about COVID-19. We feel discouraged, irritable, angry, withdrawn, and of course, feeling overwhelmed. Next slide, please. Let's look at the people at the most risk, the most vulnerable population. They are at the extreme of ages, the children and the elderly, those with chronic illnesses, the frontline workers, which means the physicians, the nurses, the caregivers, the paramedics, people who are dealing with COVID-19 positive cases. They are at a very, very high risk and vulnerable for stress and anxiety. People with substance use, mental health problems, people who have inadequate coping abilities. They do not know, they have not learned how to handle under stressful situations. And certain personalities, people who tend to ruminate, people who have generally remains worrisome, people with passive personality, people with dependent personality, and to some extent, people with obsessive personality. Next slide, please. Baba has said about the management of any anxiety or stresses. You are always your own best guru, your own best teacher. The answers are always inside you. And this is so true, because that's what we are going to go on to talk about. Next slide, please. The current state of pandemic has caused worldwide anxiety. Anxiety can be manifested when you lose control, when we become fearful, especially when the outcome is unknown. So how do we manage this anxiety within ourselves? Not the world, but within our individual self. We have to change our direction of thought and behavior. We can actually turn this COVID situation to your own favor. The power of attention. The power of attention is such that the more attention we give to anything, the more closer it comes to you. Your goals or results will come to you. The basis of neuroplasticity is actually based on this principle. So become very careful. Become very careful of what you are paying attention to. Avoid paying attention to unhelpful media, misinformation. Avoid being exposed to constant alarming, anxiety-enduring stories. They will convey to us that there is something to panic about and perpetuate myths, rumors, misinformation, uncertainty, and of course, anxiety. The more we allow ourselves to be exposed, the more frightening it becomes and less chances to distract ourselves. Limiting your exposure about COVID-19 will surely reduce the panic feeling. Let me talk about the connectivity. You know, God is very kind. God is very, very kind. This could be a golden period that God has given us, an opportunity of time. Time is one of the most precious gifts. How wisely we can use it is our business. Very important time to connect with yourself. Understand, truly understand the mind and body connection. You now know the stressful chemicals like cortisol, how it affects us. To counter this, we can create a surge of healthy chemicals like serotonin, the happy chemical, oxytocin, the youthful chemical, dopamine, the pleasure giving chemical. How do we do this? That is the question. How can we release these chemicals? Can you imagine that a simple action in your thought, words, and behavior can release these chemicals? Involving in activities such as playing, laughing, singing, walking in nature, living in nostalgic happy memories, finding moments of bliss and peace. Engulf yourself in your passion. Connect with yourself mindfully. Mm. Make each moment of yours pleasurable. That is being mindful. Go within. Introspect your thoughts and behavior. Try to get into a habit of putting a pause button on your thought just for a second and ask yourself, what was I just thinking? Was it negative, neutral, or positive thoughts? This mindful interjection is very healthy. In fact, this is the basis of cognitive behavior therapy. Become watchful. If your thoughts are fueling this anxiety of heightened concerns about health, germ phobia, focusing too much on your body symptoms, the cumulative effect of the stress and anxiety versus the calm and healthy state of mind directly influences a particular part of your each cell of the body, and it is called telomere, which is found at the end of each chromosome. Its length predicts the health status, the longevity of individual's life. It can also predict pre-illness state. Anxiety and stress has shown, there are a lot of studies, it has shown to reduce the length of telomere. This impact is felt in the body at different levels of functioning. It affects your metabolism, immunity, and your resilience. Meditation has proven to be a very powerful method of lengthening the telomere, which means optimum health, improved immunity, and strengthening your resilience. These can be very trying times, and it is time to reboot your inner strength. Remind yourself, keep your focus always there. Remind yourself, why are you doing all of this? It's for your own health, for the health of your family, for the health of the community, and in fact, for everyone. It's also time to connect socially. Video conferencing, chats, these are in. These times, they are actually better than phone. Social media and government is encouraging all of us to get on this bandwagon of virtual visits, video meetings. This probably is going to be one of the new norms. At work, at school, at play, with family or friends. Connect with people you have not been able to connect. Your grandparents would love to hear from you. Cousins, old friends. Make the connection not just about spending time. Let this be an opportunity to dig deeper into your relationship. Time to build the bridges, time to rebuild relationships, time to forgive, time to move on and make more meaningful bonding. Next slide, please. This is in particular about enhancing. Now we know that there is a mind-body connection. There is a negative cortisones and there are positive chemicals. And it is in our way of doing it. So how do we make it a lifestyle whereby we can enhance this mind and body connection? Let me talk quickly on these tools that we have. There are four components to any exercise. They are cardiovascular, which is the heart, lung, and the circulation. Then there is the tone, which means the strength of your muscles, tendons, and bones. Then comes the balance and the posture. Among all forms of exercises, yoga and Pilates, and to some extent Tai Chi, incorporates all the four essentials of exercising. The mantra is, what is good for the heart is good for the brain. Clinical studies have shown regular exercise produces chemicals as dopamine, endorphin, serotonin, which are labeled as anti-stress, antidepressant, anti-anxiety. Exercising alone is therapeutic enough that by itself it can cure mild cases of anxiety and depression. Most people will not have the access to the gym in these times. So it is important to create a daily exercise routine at home. Exercise also increases the telomere and it keeps the dementia away. Oxygenation of brain is the best way to get rid of harmful stress hormones. 20 to 30 minutes, 3 to 4 times a week is what is suggested. Studies have shown with regards to diet that the Mediterranean diet, which is also called the anti-inflammatory, antioxidant diet. Let's see what it has. It has the whole grain, vegetables, green leaves, fruits, berries, nuts, seeds, olive oil. Turmeric and other spices used in Indian food has shown to be very helpful in improving immunity and health. Indian food is very balanced. The flaw is in the manner we prepare. Many times we allow all the nutrients to leave the food. Also, we tend to fry a lot of our food. South Asians have the highest prevalence of diabetes and cardiovascular disease. It's mainly related to our lifestyle of food. And of course, there is a genetic component. Become mindful of what you're putting into your body. It's a great time to give up on alcohol and drugs. The evidence is that this pandemic has led to more dangerous alcohol and drug use practice and in fact spike in overdose deaths. Moving on to the tool of sleep. 6 to 8 hours of restful sleep is healthy. It is the time when nature works very hard to restore, repair, and rejuvenate the body. Stress, rumination, worrying keeps us up. We wake up not feeling energized. We need good sleep to run with all our cylinders. Follow the healthy sleeping pattern. No blue light in the bedroom. Switch off TV and phones at least 1 to 2 hours before going to bed. These two precautions just helps to regular flow of your melatonin, a brain chemical that regulates your biorhythm and your metabolism. Keep your bedroom temperature slightly on the cooler side. Early in the day, you should have done some physical activity. Avoid caffeine and alcohol in the evening. Use your bed only for sleeping. Read a boring book. Why? Because we are trying not to stimulate the brain. Avoid naps during the day. Just a quick word on showing your vulnerability. Many people have the idea of not to talk about what their limitations may be. Talk about your emotions, how you're feeling. It's not a sign of weakness. Like I said earlier, it's a common emotion in these times. It will allow others to open up with you. Sharing is strengthening. Ventilation is a positive emotional release. Our networking and relationship become stronger when we show our vulnerability. Next slide, please. I'm going to move on to what COVID-19 is doing and how are we dealing with it affecting the spectrum of lifespan. I'll start with the parents, children, and teenagers. Parents need to take care of yourself as you can get easily as you can easily lose yourself. Trust your intuition. Parental intuitions are usually strong and correct. Parenting is stressful, and now this COVID-19, along with homeschooling, babysitting, increase in household chores, and there is no end, especially to cooking. Take a pause. Monitor your parenting style. Question yourself. Are you a helicopter parent? Are you a micromanager? Try another, less stressful method. Take this opportunity for your course correction. Children react and learn what they see from adults around them. Children are very resilient. They learn by trial and error. They are explorer. It is also time to work on your communication and understanding them. Remain optimistic, remain hopeful. The world will re-begin, and maybe with a new norm. Parents need to watch for these symptoms of stress in their child: excessive crying or sadness or irritability or anger, regression into previous behaviors which they had outgrown, like bedwetting, biting nails, thumb sucking. In teenagers, you need to watch out of increased worries, acting out behavior, poor performance, poor ability to remain focused, inability to concentrate, avoidance of actions that was enjoyable in the past, unexplained headaches, body pains, stomach upsets, use of alcohol and drugs. So what can we do? What can we do during these times to our children? Support your child. Talk, communicate, answer their questions about COVID-19. Reassure your child or the teen that they are safe and it is okay if they feel upset. Tell them how you deal with your stress. Limit your family coverage on COVID-19 through social media. Children can misinterpret what they hear. Try and keep regular routine. Be a role model. For couples, evidence is that in pandemic, the rate of divorce is higher by 25%. There is an increase in domestic violence. As we are in close quarters with each other, and if you have felt cooped up in a relationship prior to the COVID, these underlying issues come up more easily on the surface. The difficult issue becomes more intolerant. Coping abilities become less, and breakdowns is much easier. We are all individuals, but we can be both individuals and as couples. Learning to let go. Learning to let go is the mantra to strike a balance. Let go of a bit of individuality and find a middle ground. Remain strong, but remain flexible. This indeed is an amazing time in learning to let go. I'll move on to the elderlies. They can be the most scared, most anxious, and literally fearing for their lives. Their supports have significantly declined. The impact of isolation can be life-threatening. They need to be even more closely monitored, more regular checkups. Let this time provide more intergenerational connection. Try new ways to bond. Lead them into nostalgic lanes. It is time for new learning and sharing each other's interests and passions. When one generation teaches the other, all will benefit. There is a lot of wisdom to be transferred. This is the opportune time. Support them by checking on their needs, over-counter medications, monitor their medical supplies, their wound care, incontinence supplies, dialysis, oxygen. Stock up on non-perishable food to minimize trips. Support them by shopping for them to minimize their exposure. Next slide, please. A quick word on the future of COVID. There are going to be two spectrums. It will never be the same. There will be a new norm. And many of people during this time have had various losses of job, occupation, financial, health, and of course, some have lost their loved ones, not in an expected manner. Grief and adjustment will be seen and is needed. The other spectrum, it'll be better than before, with deeper connections, healthier mind and body, improved resilience, learned to let go, had an opportunity to prioritize your values, evolving of a healthy community. Hopefully, we become more compassionate and accepting. Some will benefit, but remember, this too shall pass. And so, let's become collectively strong. And I remember Churchill had said, never let crisis go wasted. Next slide, please. These are some of the reliable sources of information of COVID-19 from website. You can receive them from the website of World Health Organization, Health Canada, Center of Disease Control, health links of each of the provinces, and of course, your local health authority. Thank you, Swami. I thank you for this opportunity. I truly feel so very blessed. Side up.
Ram, everyone. Thank you, Brother Atul, for that wonderful talk. We've brought up your video here now, and we do have a few questions
Sure.
from the audience that we would like to address. Would like you to address. I'll start off with one of the questions is, or a few of the questions we're asking about specifically children and how do we educate children about the topics that you've discussed, and what's a more child-friendly way of explaining stress and anxiety and coping to children?
Such an important question because it's relevant, and sometimes situations like COVID or any pandemics or calamities, they happen for giving us an opportunity to open up a discussion, which sometimes becomes very difficult to talk about with children. Children understand simple language. So talking about feelings is more easier for them to understand. Complicated words, long durations of talking, sense of being preached upon is not, it doesn't sink in well with them. Talking in a playful manner, short periods of time, and talking sincerely and directly. A question and answer is a better way of chatting with them. The tools we all know, parents know how to handle that. But this ongoing level of communication and talking for a shorter period of times and telling them of importance of having a healthy lifestyle. I think that is the key of training them to have a very healthy resilience. Let them know that life has its ups and downs. Like Swami, I have put up a slide over there that calamities and stresses do happen in life. It is between the two joyous moments that these stressful situations come. And during these stressful situations is what they need to be prepared for. So it doesn't need to be prepared at the time of calamity. It is an ongoing dialogue. It's an ongoing training. It's an ongoing building their strengths. And once they are able to know, they need to be reassured that they will fall down. They will have difficult times. But it is during those times, if the communication doors are open, that they are more open to talk about these things. All parents know what to do. You don't need a psychiatrist, you don't need a psychologist. You need the tools, you need the opportune times. And opportunity times you have to grab and you have to find. It doesn't happen of a normal dialogue. You cannot walk into a psychologist's office or my office and say, teach him this or teach her that. It is not going to work that way. It is an ongoing, constant lifestyle. How you teach your people to cook, to stand, walk, talk, do the other milestones of life, being supervisory, allowing them to explore, allowing them to make errors. It's important. They have to learn few things, tools of life by their own experiences. Experience is the best teacher for them. but they need to know you are there. They need to know you're supportive, standing right beside them. You need to reassure them that you're constantly there. And if they are not talking about it, you need to talk about it. How was your day? It was good is not good enough. You need to probe in more. What do you mean it's good enough? So the more you engage, the more you talk, the more you relate to them, the more easier it becomes for them to talk. So it's a lifestyle of communication, building their strength, and allowing them to experience what they need to experience. I hope I've answered.
Yes, thank you for that answer. There's another question about the credibility of evidence. There's a lot of conspiracy theories about COVID-19, as well as a lot of misinformation that's spread through social media. And that causes additional anxiety for the general public. What resources or what reputable sources should people be turning to get clear advice on COVID-19?
My last slide, that is the most reliable, most scientific, evidence-based. Avi, do you want to put that on the map over here or on the slide?
Sure, I can put the slides back up.
Or I can just repeat that. It's
Yeah.
please go to the website of World Health Organization, coming more down to your own country, Health Canada, then coming down more narrower to the Center for Disease Control. Each province has their own health link, and then of course your local health authority. All of these are the most reliable sources of information for COVID-19. Don't go on any other resources. They may be having some truths to it, but they make it more sensational, and it just drives in more anxiety and nervousness.
Okay, thank you. There is a request from Dr. Revathi asking if we can have a presentation for the SSE students ranging from age 5 to 15, and that is something that the medical wing can look into. We'll communicate directly with you for that afterwards. There is a question here about can community service help us to overcome our own anxiety, fears, and stress?
Of course it can. Very good question, because there's a lot of opportunity there. I know of number of people among my group of friends who are engaging in volunteering their time. You don't have to be putting the precautionary sides on the side. You have to follow the social distancing, hand hygiene, sanitizing yourself, and being mindful of all the person-to-person contact. Having said that, there are many opportunities. And the more you get involved in the community, the more this altruistic behavior gives you an immense sense of satisfaction. It just makes you feel right. You're feeling right of what you're doing, feeling right about helping other human beings. I think involving yourself in community work also gets rid of your own anxiety, because there's more opportunity of talking, there's more opportunity of engaging. The bonding of just understanding somebody speaking the same language, the emotional language, speaking and doing the same thing, sharing is strengthening. So of course, please continue to do, and there's a lot of need. In these days and times, the opportunities have really widened up and broadened up, and everybody wants any kind of help that people can spend their time in, use their time in. So please get engaged. It's very helpful for you as an individual and extremely very powerful help to the community.
Okay. Also, there's a question about using mindfulness and meditation to manage stress. Can you comment on mindfulness, and then also perhaps if there are any resources that you're aware of that people can use to get into meditation or mindfulness more?
This is one of my favorite topics. There's volumes and volumes I can talk on this. The scientific evidence is yes. They are proving to be one of the most powerful vehicles of addressing your anxieties, of increasing your resilience, of remaining your mood remain uplifted, more connectivity with your sense of bliss, and so you enjoy each and every moment of the day if you're mindful and you're practicing meditation. Uh, there are many angles to, I'm just talking because today I'm wearing a cap of a physician, so I'm only going to be talking from medical model. Spiritually, you know better. All of you are very up there in the path of your spirituality, and you know how connectively or your growth is through this path of mindfulness and meditation. I spoke about telomere. Telomere people who first found this telomere was Elizabeth something, and she got a Nobel Prize for discovering telomere. Please read on that. Please Google on telomere, and you will know what I'm talking about. It is found in each and every part of our cell, of each chromosome, and if you can just maintain healthiness of telomere, uh, it will keep your life very healthy, mind and body connectedly. Telomere has proven that the strength of telomere is with less of stress, less of anxiety, and your meditation is the one of the most powerful methods of keeping your telomere healthy. So I would encourage all of you, please read on telomere. Please Google, go read on these things. Very, very important parts of doing that. There is so much of information of mindfulness, and there's so much of information on meditation. Very difficult for me to tell you which one is better than the other. I think each to his own. Go to a bookstore like Chapters, walk into your help section, your own help section, and there are numerous books over there. There are beautiful authors, their own experiences, techniques of how you go into that. Mindfulness came into practice, or the word mindfulness, about 10 years ago. Now you have many psychologists who are experiencing this. There are books on the person who started this mindfulness, though I think it has been existence since ages, and many years. In our Hindu mythology, you can see the mindfulness was there, existing even before. But let me not distract myself. So the mindfulness, I am forgetting the name of the person who had discovered it. It's Zen.
John Kabat.
Somebody?
John Kabat-Zinn.
That's right. Yeah. So he's the one who discovered mindfulness. Thanks, Nishi. And so you can take up his book. Uh, he speaks very deeply on things. Uh, some of them are not user friendly, but his workshop books are very good. So there's a lot of volume of information there on mindfulness and meditation.
Okay.
Thank you.
Okay. There's some comments in the chat about the importance of pranayama. Are you able to briefly comment on that? Breathing exercises?
Yeah, I'm not an authority on these things. Uh, I'm a practitioner of these things. I'm also learning as the time is going by. So I do practice pranayama, but I do it in a very small way just to get into the meditative state. I use it for that. I think Buddha he insisted or stressed the importance of pranayama. It goes even before that. So one of the vehicles to induce yourself into the very trance and meditative state is using pranayama. There's a lot of health issues of how you have to do it properly. Some of the gurus and out there in India, they say if you do it this way, you can achieve many things. And if you don't do it this way or wrong way, there are ill effects to that. So just be watchful, be careful what you're trying to read and what you're understanding before you get into that. Experiment slowly and then keep increasing and getting more expert into this. I think it's all correct if it's done properly and wisely.
Thank you. And just to clarify, there are some questions about telomeres, and just in a simple term, telomeres are actually parts of our genes in our cells. There are these structures called telomeres, and they have been implicated in many things such as stress and aging. So correct me if I'm wrong, Dr. Nanda, that's what the general meaning of telomeres are.
Yeah, telomere is a part of the end part of the chromosome. You know, the RNDA axis, and at the end is the chromosome. It's like described like a shoelace. You know, all the threads of the shoelaces are joined together at the end so that it can slip through the shoe holes so that the lace can go in through that. So that part, end of the shoelace, is very similar to telomere on a chromosome. And the length of the chromosome, telomere has built-in of cells which regenerates and keeps the length there if you're doing the right thing and leading a healthy life. It starts to shrink after the age of 20 or 25, and then you need to keep it replicated and healthy. After the age of, I'm talking of natural telomere life. So after the age of 75, it becomes very difficult for it to regenerate. And that's when you start to find this thing. But any processes of inflammation, any process of toxicity in your body, your mind or body connections, if there is anything toxic or ill health going on, it will reflect the telomere. The studies have gone to such a depth that if the telomere is starting to shrink and regeneration is becoming slower, it is telling you that there is some chronic illness which is going to happen. They can even predate it that within 5 years, your health is going to go down if you carry on in the way you're doing. And you change that, and within 3 months, you start to notice that it is again coming back. So it's very interesting that to focus your health only on telomere can get you to know as a parameter of what you're doing is right or wrong. There are many such parameters in our body. Our body is the most magnificent invention of God among so many other beautiful things He's made. But this machinery is so perfect, and there are many ways of looking at your health, and this is just one of the ways of looking.
Thank you. In the chat, Brother Ravi has shared that there are several government programs that are providing funding for vulnerable populations, seniors, and those with food security issues and mental health issues. And he points us to a website, risingyouth.ca. Now, I haven't reviewed the website, but neither has the medical wing, but that is potentially a resource that you may check out. It's in the chat box. There is a question, Brother Atul, asking about the 4 types of exercise. If you want, I can potentially address that. Are you aware of the 4 different types, such as cardiovascular exercise, toning, muscular?
Yeah. Are you asking me?
Yeah, so just about the 4 types of exercise.
Yeah, I did mention that a good exercise program is one which addresses all the 4 components of exercise, which is the cardiovascular, the tone, the posture, and the balance. So any form of exercise which incorporates or which you can incorporate, and you don't need to stick to one form. But among the modalities of exercise, yoga and Pilates are the one which incorporates by itself all the 4 components, and to some extent Tai Chi. But you can each to his own, whatever gives them the pleasure. If they are interested only in biking or hiking or swimming or weightlifting or whatever their pleasure is, moving is good. So in whichever way you move, it's good. That is the basis. But if you can incorporate all 4, that is the ideal form of exercise.
Okay. And as a geriatric psychiatrist, the elderly are not able to visit with their family members, and they often see these visitations as a great help to their mental health. How can the elderly who may not be as tech savvy or as, how can they remain in touch, and how can they cope with mental health stress during this time?
Yeah, see, I work with long-term care people, and many of them are not tech savvy, and they still need to be in touch. But the phone is one of the still the most common media with the seniors. So if they cannot FaceTime, which would be better than phone calls, then the phone calls is better. If not, then conveying it through somebody. I'm talking of long-term care. So they can convey it through the nurses, caregivers, then the message passes on. But phone is a very good modality of doing that. People also do what we call as window visits, seeing each other through the windows. You can touch, you can still hear them because you have phone at both the ends and you see each other. It's not the same. It's a new adaptation of communication, something better than nothing. So whatever works in situations for a particular elder, because in at that age they are in a very different situations. Some may be living with the family, some may be living independently, some may be in nursing homes, some may be in independent living, some with spouses, some with not spouses. So but any form of communication, any form of seeing each other or hearing each other, I think is extremely, extremely important for them. They are hanging on to these ropes of communication.
Okay, thank you. That concludes the question session. I'll be switching the video over. Thank you, Brother Atul, for those wonderful answers and the excellent presentation. I'll be switching the video over to Sister Nishi to make some comments.
Sairam, Brother Atul, thank you so much for the wonderful presentation. I think it was a lot of benefit for all the people on the call. It is going to be posted onto the medical website for others who missed the presentation, that they can view it from there. We have recorded the presentation, so I really I'm so happy that we were able to do this with Swami's grace. And this is one of the first webinar initiatives that we have started from the medical wing, with more to come. And certainly if there are some pertinent topics that we want from all of you to please let us know that what would be of need. We have been, from the medical wing, have been advised that mental health issues are one of the #1 areas of concern. So we will be doing further initiatives in this area, in addition to other health areas. But one of the initiatives that we are doing is to start doing some workshops in cognitive health, cognitive therapy, which will be available across Canada. So it is called Living Life to the Fullest. It is in a partnership with the Canadian Mental Health Association of BC and across Canada. So we will be sharing that with you in the months to come. It's a great program. We've run a couple of pilot programs in BC with great success, and we hope to transition it out across the country. In addition, we will hopefully start to do some work with SSE, as well as other webinar initiatives that we can help to deal with the mental health and mental stress issues. I want to really thank Brother Avi Ramaswarup and Sister Patricia Stevens. We as a medical team have been working together for the last couple of years, and it's just wonderful. We all bring our energy together and want to serve all our Sai devotees in the community across Canada, as well as the community at large. So we look forward to hearing any feedback or any participation that you would like us to be involved in, as well as, again, just off topic at this point, but certainly the anxieties that are coming around sometimes with the Sai Center opening or not opening. We have sent some information to all the Sai Centers in that regard. Please do follow up with your centers with regards to what's happening in your particular area. So I thank you, Brother Atul. Thank you, Avi. Thank you, Patricia. Sairam, thank you, all of you, for joining us today. And we hope to meet again in the future. Stay Sairam.
Right.